Hi, my name is Brooke Delahoy, and I'm a genetic counselor.
My name is Caitlin Shetland, and I'm a genetics clinical coordinator.
If you are watching this video, it may be because genetic testing for a hereditary cancer risk has been suggested by your healthcare provider, or you are concerned about your hereditary cancer risk.
Results of genetic testing have potential impact on future cancer risks, cancer treatment, and/or your family members' cancer risks.
In this video, we hope to provide you with information about genetic testing so that you can make the decision that is best for you.
You may consider genetic testing because you want to find an explanation for why you and/or your relatives developed cancer, want to have the best information to make decisions about your cancer treatment, want to have the best information about your future cancer risks and cancer screening plan, or are concerned about the cancer risks for you or your family members.
In this video, we will review information about how often cancer is hereditary and risk factors for hereditary cancer, explain what causes hereditary cancer, review the possible results from genetic testing and how these results can impact your medical care, and lastly, review the risks, benefits, and limitations of genetic testing.
Everyone has a risk to develop cancer. In fact, on average, over a lifetime, 1 in 3 people will be diagnosed with cancer. The majority of cancers are not hereditary. They are instead caused by a combination of many different factors, such as the normal aging process, lifestyle, the environment, and other factors, including random chance. However, a person may develop cancer because they were born with an increased risk for cancer. This type of cancer is called hereditary cancer. On average, 1 out of every 10 cancers is hereditary.
Red flags for hereditary cancer include cancers diagnosed at early ages, such as breast or colon cancer, diagnosed before age 50, multiple family members with the same type of cancer, rare cancers in a family such as ovarian cancer, pancreatic cancer, or male breast cancer, unusually aggressive cancers such as prostate cancer that has spread to different areas of the body, several different cancers in one person, and ancestral background may also increase the risk for hereditary cancer.
You might be wondering what causes hereditary cancer. It's in our genes. Genes can be thought of as instruction manuals, and each gene has a specific job in the body. Some genes determine our eye color or how tall we will be, and other genes help to protect us from developing cancer. We inherit our genes from our parents, one from our mother and one from our father.
Our genes are written in a code. This code is called DNA. If there are any changes or mistakes in the DNA code of a gene, it can harm the gene and stop it from working. These mistakes are called pathogenic variants, sometimes referred to as mutations. When there is a pathogenic variant in a cancer prevention gene, it increases the risk of developing cancer. The goal of genetic testing is to identify inherited pathogenic variants in cancer prevention genes. Genetic testing is most informative for the whole family when it starts in a relative who has had cancer. Current technology allows us to test many genes associated with risk for many different cancer types. This is called a hereditary cancer gene panel. The genes tested are associated with cancers such as breast, pancreatic, ovarian, colon, and others. These genes may have different levels of risk for cancer. Sometimes the risk for cancer is less clear for genes that have not been studied as long.
There are 3 types of genetic test results you may receive when you do genetic testing: positive, negative, and a variant of uncertain significance. Let's review all 3.
A positive result means a pathogenic variant or harmful change was found in one of the genes tested. This means you were born with an increased risk to develop certain cancers. A positive result does not necessarily mean someone has cancer or will ever get cancer. It only means they have an increased risk to develop cancer. This result may provide an explanation for your personal and/or family history of cancer and may clarify your future cancer risks. By knowing about inherited cancer risks, you can take proactive steps in your cancer screening and management. A positive test result may help to guide decisions about cancer screening, management, and prevention, guide the course of current cancer surgery or treatment decisions, and by taking these steps, it may even help to prevent cancer or detect it at an early treatable stage. A positive test result can also provide important information to your relatives, who may then wish to consider genetic testing. Both men and women can inherit and pass on a pathogenic variant in any of the genes tested.
A negative test result means no pathogenic variants were detected. This means you have no known hereditary risk to develop cancer. However, a negative result does not help us explain why you and/or your relatives developed cancer. Additionally, even with a negative result, everyone has a baseline risk to develop cancer. This risk may be influenced by a family history of cancer, person's age, lifestyle, environmental, and other factors.
The third possible type of result is a variant of uncertain significance, or VUS. This means a genetic change was identified, but there is limited information at this time about the meaning of this finding. The most common explanation is that it is not a harmful pathogenic variant, but instead a normal variation in the gene that is unrelated to cancer risk. The other possible explanation is that it is a harmful pathogenic variant associated with increased cancer risk. Because there is not enough information at this time to know which explanation is the correct one, and because most variants of uncertain significance are ultimately determined to be benign, normal variants, decisions about cancer screening, treatment, and prevention should be based on your personal and family history.
There are benefits to genetic testing, as it may provide reassurance and lead to a reduction in anxiety, whether the results are positive or negative. A positive test result may also help to explain your personal and/or family history of cancer, clarify cancer risks for you and your family, and allow for a personalized cancer prevention and screening plan in the future.
There are reasons why someone may decide not to pursue genetic testing. Some people are concerned a positive test result would lead them to worry or will negatively impact family relationships. Some people are worried about discrimination after genetic testing. There are laws, such as the Genetic Information Non-Discrimination Act, or GINA, in place that provide some protection from discrimination based on genetic test results, particularly with regard to employment and health insurance. However, these laws do not apply to other types of insurance, such as life, long-term care, or disability. Individuals without a cancer diagnosis may wish to apply for policies prior to genetic testing. A positive genetic test can also impact decisions about fitness for duty in the active military.
Limitations of genetic testing include a pathogenic variant may be present in a gene that was not tested, or, in rare cases, a pathogenic variant may be missed. There could be genes discovered in the future that may require additional genetic testing. It also does not tell us whether or not someone currently has cancer.
Patients often have several questions about the genetic testing process. Genetic testing is most often performed from a blood sample, but may also be performed from a saliva sample. Most insurance companies cover the cost of genetic testing, especially for those with a strong personal and/or family history of cancer. The results of your genetic testing will be entered into the medical record and be available to members of your healthcare team.
If, after watching this video, you have questions about genetic testing or are unsure if genetic testing is right for you, please talk to your provider during your appointment. You also have the option to meet with a genetic counselor before undergoing genetic testing. If you prefer this approach, please make your provider aware. If you would like to have genetic testing, please talk to your provider to coordinate.
Thanks for your attention. We hope that you learned something new about genetic testing for hereditary cancer by watching this video.